The appendix, a small, tube-shaped organ attached to the large intestine, has long been a subject of curiosity for scientists and doctors alike. While the exact function of the appendix remains somewhat unclear, its role in the body is believed to be related to the immune system, particularly in the early stages of life. However, when the appendix becomes inflamed or infected, it can lead to a medical emergency known as appendicitis. Understanding the causes of appendicitis and the treatment options available is essential for managing this condition. Appendicitis occurs when the appendix becomes inflamed, typically due to a blockage inside the organ. This blockage can be caused by a variety of factors, including the buildup of mucus, stool, foreign bodies, or an infection in the digestive tract. When the appendix becomes blocked, bacteria trapped inside the organ can multiply, leading to infection and inflammation. As the infection worsens, the appendix can become swollen and filled with pus, causing increased pressure in the area and resulting in severe pain. The exact cause of appendicitis is not always clear, but certain factors can increase the likelihood of developing the condition. For example, individuals between the ages of 10 and 30 are more likely to develop appendicitis. Although it can occur at any age, the condition is more common in men than in women, though the reasons for this are not fully understood. Some studies suggest that a family history of appendicitis may increase the risk, indicating that there may be a genetic component to the condition. Infection is another major contributing factor to appendicitis. Bacteria from an infection in the digestive tract or from an injury that introduces bacteria into the appendix can lead to inflammation. Additionally, certain viral infections, such as gastroenteritis, can also cause inflammation in the appendix. These infections can disrupt the normal functioning of the appendix, leading to its obstruction and eventual inflammation. While the exact mechanism behind the obstruction of the appendix is not fully understood, several theories have been proposed. One common theory is that the appendix becomes obstructed by hardened stool or a buildup of mucus. This creates a blockage that prevents the normal flow of contents through the appendix, which can lead to bacterial overgrowth and infection. Another theory suggests that the blockage may be caused by an infection elsewhere in the digestive tract, which spreads to the appendix. In some cases, an abnormal growth or tumor may also block the appendix, leading to appendicitis. The most common symptom of appendicitis is abdominal pain, which typically starts around the belly button and then shifts to the lower right side of the abdomen. The pain often intensifies over time and becomes more localized as the infection worsens. In addition to pain, individuals with appendicitis may experience nausea, vomiting, loss of appetite, and fever. The symptoms can vary from person to person, but if left untreated, the condition can rapidly worsen. In some cases, the appendix may rupture, leading to the spread of infection throughout the abdominal cavity, which can be life-threatening. If appendicitis is suspected, it is essential to seek medical attention immediately. A healthcare provider will typically perform a physical exam, during which they may press on the abdomen to check for tenderness and swelling. In addition to the physical exam, blood tests may be conducted to check for signs of infection, such as an elevated white blood cell count. Imaging tests, such as an ultrasound or ACT scan, can also help confirm the diagnosis by revealing signs of inflammation in the appendix. Once appendicitis is diagnosed, the standard treatment is surgery to remove the appendix, a procedure known as an appendectomy. An appendectomy is usually performed as an emergency surgery to prevent the appendix from rupturing and causing further complications. In most cases, the surgery is performed laparoscopically, meaning that the surgeon makes small incisions and uses a camera to guide the removal of the appendix. This minimally invasive approach allows for a quicker recovery time and a lower risk of complications. In some cases, a traditional open surgery may be required, particularly if the appendix has ruptured or if there are complications that make laparoscope surgery difficult.